A lot of people like to complain about government bureaucracy, but never before in any of our lifetimes has the bureaucracy been more important to helping steer us through a global pandemic. That's one of the reasons we have invited into the stream Kathleen Sebelius, the former Health and Human Services Secretary during the Obama administration, as well as our correspondent on health, Anjali Kamlani, to discuss the steps that are going to happen in the next several weeks and months to protect us all from coronavirus. Secretary Sebelius, it's good to have you here. And I wanted to ask you, we're expecting the emergency use authorization any day now for one of these vaccines, either Moderna or Pfizer. What advice would you have for the rollout to get this to us for, for President-elect Biden?
Well, I think a couple of things are really important. First of all, the vaccine news is very good and encouraging. What we need people to understand is we're talking about spring of next year before average Americans can really expect to receive a vaccine. So we have to take some steps now to not lose a couple 100,000 more people. That's what we're on track to do. 200,000 more Americans could die if we don't take steps immediately. And that's a very scary situation. I think the Biden team is trying to do what they can to prepare for the enormous logistics of vaccinating an entire country. But frankly, they need outgoing President Trump to cooperate. They need to get into the key agencies. They need to see what plans are already in place in terms of logistics and distribution. They need to start a very clear communications message, because the worst of all worlds is to have a safe and effective vaccine, either not be able to get it to the right people at the right time, or have people say, we don't believe it's safe. We don't believe it's effective. We've heard so many mixed messages over the months that we're actually not going to get vaccinated.
Secretary Angela here. I know that we've heard a lot about Operation Warp Speed, and even Secretary Azar today was on a call with media discussing the operations and the idea of distributing the vaccine. But that's, again, going to take place during a Biden administration. What would you say is the likelihood of Operation Warp Speed in its current sort of existence continuing? And should the Biden administration look at it to continue, or should they change certain things about it?
Well, Anjali, I for one don't know much about what is in the next stage of the plan. What we knew is that the government infused a lot of money into possible vaccine candidates and manufacturing slots, and that's very good news. That expedited the stage of developing a safe and effective vaccine. We hope that the FDA will move quickly. What exactly is their logistics plan? How far along are they? My understanding is they've contracted with one of the three potential distribution companies. If we have two different vaccines, we're probably going to need to amplify that distribution. How are they going to get vaccine to tribal communities, to lower served areas? What is the responsibility of the governors versus the federal government? All of those questions, I think, are ones that the Biden team is trying desperately to answer, but they need to be able to directly communicate to the people who are in charge right now, to know what the handoff looks like, to know if there are gaps in the planning. My understanding is governors are being told to figure out when a vaccine arrives, how to get it to people in their states. That's very complicated, particularly since most state and local governments don't have the resources to do that. So what is the federal government going to do? What's their responsibility? Where are the gaps? And how can a new Biden team work very quickly to fill the gaps? 9 weeks from today is the inauguration. That's not a long period of time to get ready for this massive 2-dose vaccination of 330 million people.
Secretary Sean, when we talk about the vaccine for the general public, like you said, it's still months and months away. What should the Trump administration be doing today, right now, when we see record number of cases day in and day out? What would you like the national response to be today?
Well, I keep hoping that the president, first of all, will allow the transition to go forward. That's step one. Get the GSA to sign the documents, let the Biden team into every agency, let the COVID task force that Trump put together, communicate with the new COVID task force. That's really, really important. Secondly, the president has to acknowledge we are in a dangerous time. People are dying. Our caseload is up over the last 2 weeks is up 80%, 80. Hospitalizations are up almost 40%. We have 11 to 1,200 people a day dying. This is a very, very dangerous period, and we need some straight communication coming out of this administration. Wear a mask, social distance, keep home as much as you can. Don't gather with relatives or friends and family for holidays, as difficult as that may be. You want to see future holidays with them. I mean, we're talking about a deadly disease that right now America is not got under control in any way, shape, or form. So we also need to really ramp up testing. That's on this administration. Get tests out to communities so they can do asymptomatic testing and begin further quarantining and isolating folks who have the disease, and make damn sure we have enough protective equipment to deal with the surge that's coming. What we know is case identification is 2 to 3 weeks ahead of a surge. And right now we have hospitals all over this country that are jammed with COVID patients, starting to cancel elective surgeries again. If you have a heart attack or a stroke right now and you're in the middle of the country, like where I live in Kansas, you're not going to have a hospital bed. You may be in really terrible trouble in an emergency. So we're in a crisis right this moment. And we have a president of the United States who hasn't spoken about this in weeks.
So you were at HHS. You came in around the time the country was first dealing with SARS, and you were leaving HHS around the time that Ebola was threatening the United States. So you dealt with these kinds of but let me ask you personally, when the agencies of the federal government refuse to cooperate with a president-elect, and then members of Congress enable that stance, personally, what goes through your mind?
Well, I think it's criminal, frankly. I think we are in a life and death situation for far too many people. This is not about a petulant president who can't admit that he lost an election. This is about people's lives every day, and refusing to share information, refusing to allow the team coming in to get ready for what would be, under the best circumstances, a massive logistic effort, a massive national undertaking. We have a federal government who, other than Operation Warp Speed, which was solely aimed at the vaccine, that's good news, but it shows what the muscle of the federal government can do in partnership with the private sector. We need that kind of effort on every front. We need it on logistics. We need it on mask wearing. We need it on communication. We need to have priorities spelled out. Joe Biden has a view that the federal government has to take the lead, but he can't even get the information to find out where the gaps are right now from the outgoing administration.
Staying on that federal agency platform, I think one of the most interesting things has been the damage done to the credibility of some of the agencies, including to the HHS, for not taking a stronger stance and not doing more. I just wonder, what would you say to Secretary Azar right now, or what advice would you give him just with just few months left in order to help change the course?
Well, I continue to be optimistic. I'm not quite sure why, but I continue to hope that the health officials in place right now will step up and tell the truth to the American public, will step up and deliver the kinds of services and support that they need. We've seen sidelining of the CDC, which is the public health backbone of this country, and enormously important for both communication, but also priorities of who gets vaccinated first, how we track the disease, what kind of information comes in, how transparent that is. They need to be front and center once again. I think in the incoming team, Joe Biden knows these federal agencies well. He also went through H1N1 at the beginning of the Obama administration, and he went through the Ebola crisis. So he is well suited, as his team is, to deal with this. But right now they are being blocked in a way that we've never seen before in this country. And the United States Senate not only is empowering the current administration from not conducting the transition, not sharing information, putting us in a very precarious, I would say, threatening our national security. But Mitch McConnell also is sitting on a relief package. If you want people to stay home, if we want people to think about restricting their commercial activities, we need to be sure and put some resources to those individuals. We need to make sure that cities and states are ready with the resources, with hiring additional personnel to get ready for a national vaccination effort. We need to have some resources available to counter what could be the economic downturn. So again, Mitch McConnell sort of has the keys to the castle. Both they could insist that the president move ahead and that the GSA move ahead with the transition, and they can pass a financial aid package, even if it isn't all of what is needed. Get some money out to cities and states, get some additional unemployment insurance going. So when people think that it may be a better choice to stay home and not spread the virus, they can feed their kids and pay their rent.
Secretary, you mentioned before how so much pressure has been placed on the governors here over the last several months because of the lack of a national strategy. I'm curious from your perspective, from how you've seen various governors handle the situation. Are there any states that you think that have handled the pandemic exceptionally well up to this point?
Well, I think a number of governors stepped up and stepped out and spoke up and tried to follow the science as much as possible. They have been in what I would say is an impossible situation. The Democratic governors who tried to do this, like Gretchen Whitmer, like our governor here in Kansas, like governor in Virginia, were attacked by the White House. A president of the United States chose to play partisan politics with the governor trying to keep his or her citizens safe and secure. We've never seen that before. Governors have been told since March they're on their own. Go find your own protective equipment, bid against one another, and in some cases, bid against the federal government. Never seen that before. Never have had the federal government literally walk away from a national health crisis and say, you are on your own. So I think governors, Republicans and Democrats, will welcome a defined federal role, will welcome the notion that the federal government will use and muscle all of the financial resources, the logistical resources, the communication resources to help us get through this. So they won't be trying to fight this a state at a time, a border at a time, and fight with the White House at the same time.
Kathleen Sebelius, the former Health and Human Services Secretary, thank you.